to the White his duties, they say.
Okay, we'll go ahead and get started. Just want to apologize in advance for the short notice on this call and the noise in the background. We're doing this from Hartsfield Jackson International Airport in Atlanta, Georgia. So it just came on, so I apologize in advance for that. Luckily, most of the speakers will not have that background noise. So I'll just kick this thing off. Thank you for joining us for our monkeypox media availability. On the docket today will be Kevin Dick, District Health Officer in Washoe County. We'll have Dr. Nancy Dow, our Division Director of Epidemiology and Public Health Preparedness, and also Lisa Lotritz, our Division Director of Community and Clinical Health Services. I will post the press release in the chat and also the names and spellings and the titles of each of the speakers. With that, I'll get right to it to Kevin. Kevin's also in the airport, so I apologize for all the noise in the background, but Nancy and Lisa's mics won't have that noise. So Kevin, if you're ready, please go ahead.
Yeah, thank you, Scott. I apologize for the background noise here. I want to thank everybody for joining us today. We are reporting our first probable case of monkeypox in Washoe County, and this is something that we are not surprised to have occurring. We've been watching the news nationally. We've been seeing monkeypox cases occurring and spreading throughout the country. So we want to remind everybody to be vigilant and to be looking for symptoms of monkeypox. If you do have symptoms, please contact your doctor and speak with them before showing up at their office. And also just be aware of taking precautions to avoid the spread. Fortunately, this is not spreading as contagiously as COVID-19. With that, I would like to turn it over to Dr. Nancy Dow, and hopefully a brighter background in your office. Please go ahead, Nancy.
Great, thank you, Kevin. So we're reporting our first probable monkeypox case here in Washoe County. The case has been tested orthopox positive. The specimen is being sent to CDC for confirmatory testing. The case is a male in his 20s with recent domestic travel. He did not require hospitalization and is isolating. Monkeypox is spread through close person-to-person contact. Most people don't have a very severe case of monkeypox, can be managed conservatively with regular care, and the current strain seen is rarely fatal. What's different about the current outbreak we're seeing around the globe right now is that we're seeing a large number of outbreaks in non-endemic countries. In the past, we've seen the occasional outbreak or a select few cases related to travelers or linked to animals from endemic countries, but not in this scale globally. So because of that, we do want to be aware. Symptoms of monkeypox can include fever, headache, swollen lymph nodes, and general malaise, which are often in the prodromal period. Most importantly to note is the presence of a characteristic monkeypox rash. As Kevin said, people with symptoms should reach out to their medical provider for assessment. If you have a new unexplained rash, especially with recent exposure to a case, avoid contacts with others and reach out to your provider. And with that, I'll pass it now to Lisa Lotritz to discuss monkeypox vaccine and testing.
Thank you, Nancy. So I will just let you know we do have the vaccine here at the Health District, Jynneos, and also known as Imvamune and Imvanex. We have a very small supply. We're working with the state and our federal partners to get the vaccine as we need it. There isn't a large supply available right now, but that will change as in the coming weeks and months. The distribution is out of our hands. We are allocated a certain amount, and that is what we have available. And it's coming in phases. So we did receive a small amount last week, and then additional doses this week, and that will continue to come in phases. And hopefully more doses we will receive more doses in each of those phases. Right now, the vaccine is only available for confirmed contacts to a known case and for laboratory personnel who are handling the specimens. Just to let you know a little bit more about the vaccine, it's a 2-dose series. The doses are 28 days apart, and an individual is considered fully vaccinated 2 weeks after their second dose. Even though someone is fully vaccinated, they should still continue to take steps to protect themselves, like from the infection. Side effects include swelling, redness, firmness, and itching at the injection site. And right now, the CDC has said that the general public does not need to be vaccinated. So the vaccine is only available for our confirmed contacts and our laboratory personnel who are handling the specimens. And I'll pass it back to Scott.
Thank you, Lisa, Nancy, and Kevin for that. We'll open it up for questions for Dr. Dow and Lisa Lottritz. Please go ahead.
Hi, this is Erin at Channel 2. I am wondering if you can tell us at this time if anybody that did have close contact with the male, have they already been contacted so other people don't need to worry about it?
Yes, our team has done case investigation and contact tracing already.
This is Andrea Esparza with News 4. I think the biggest concern now is for the public, what happens next? Are we going to have to go into COVID-like protocols if this does kind of become more contagious within our community?
I can take this one. So monkeypox, we're not comparing it specifically to COVID just because, yes, there is a component where this can be spread through close respiratory droplets, but this is not in the sense of COVID where it's easily aerosolized in the community and can linger in the air. Monkeypox, you're looking at a double-stranded DNA, which is much heavier rather than a single stranded RNA in the COVID molecules that's easily aerosolized. So in terms of transmission, it really has to be close person-to-person contact. You're touching the lesion of the person, the skin, or you have a prolonged period of respiratory contact with the person.
Again, this is Andrea Esparza, News 4. I have a question in regard to the vaccines. In the release you sent, you said that you don't have too many vaccines, if at all, but you just mentioned that you did have some. So can you just clarify, is that only for people who tested positive for the monkeypox?
Actually, to clarify, we do have a very small stock of the vaccine. It is not for the ones that have tested positive for monkeypox. It's for confirmed contacts to someone who is tested positive for monkeypox. So those individuals that have been identified as close contacts, and then as well as laboratory personnel that are handling the specimens.
Any other questions?
Yeah, again, Andrea Esparza with News 4. I understand that a lot of people in the LGBTQ plus community are a bit concerned right now as they're kind of comparing this to the AIDS pandemic. I kind of want to know your thoughts on that. Do you find that the monkeypox is targeting a specific demographic of people?
I can take this one. So the risk for monkeypox, everyone can get monkeypox. Certainly risk increase if you have contact with persons with an unknown rash, or especially those who are diagnosed with a confirmed or probable monkeypox case. And also if you're traveling to endemic monkeypox areas or areas with monkeypox outbreaks. So in the current outbreaks, more cases are seen in men who had sex with men who met partners through an online website, digital application, or social event. But as a reminder, monkeypox can affect everyone regardless. And obviously, there's also some groups that may be at heightened risk for severe outcome if they contact monkeypox. This would include people with weakened immune system, children younger than 8, and pregnant people.
And then I have another question in regards to kind of what happens when we do have these lesions. A lot of people don't understand how to treat them. And is there a quarantine phase?
Yes, so as soon as your symptoms start, that's when you become contagious. Before symptoms, you are not contagious. So when you do have lesions, you need to isolate until your lesion has fully scabbed over a new skin and scab has fallen off and new skin has formed. So until you're fully healed, you need to isolate.
And I just want to get a little bit more clarification on the vaccines. You did mention that we are going to be getting these vaccines, Lisa, in phases. I understand the federal government has released 7 million doses. Many of them are expected to come till next year. What is happening here in Washoe County? And if you could explain it in kind of lame terms for the public.
Sure. So, like I said, phases, we did phase 1. We just received a very small amount last week. And then they did a phase 2A, which was this week, again, a very small amount. And they're going, it's an allocation for Nevada as a whole. So based on the number of cases and what's going on in our state, it is going to depend on how many doses we get. So I can't say for sure because it depends on what's happening. And then there'll be a phase 2B. And then from there, a phase 3 at the end of August is what they're telling us. So as more vaccine is available, we will get word from the state, our state partners, as to how many doses we will be receiving.
And what do you categorize as a small amount? Is that a few thousand, a few million?
20 doses. So a very small amount.
And from those 20 doses, how many have you administered in regard to this case?
So we have done some, we have administered some doses for precaution for our lab personnel. I can't disclose how many we've administered for this case, but we've had administered some doses for lab personnel that are handling our specimens.
Okay, and then my last question is, where can people get these vaccines administered if they do come in contact?
So they would need to first be tested, and they would contact their provider and let them know before they go in anywhere. Let them know that they're experiencing symptoms, and from there a test would be done. And if once during the investigation, if they are named as a contact, our team would contact them and advise them how to get the vaccine.
So they would contact their doctor, the doctor would contact Washoe County Health District, and then you would give out the vaccines to that doctor? So
depending on, it's for contacts to the case. So there has to be, once we have that known case, then our epi team will do an investigation. And when they determine who needs the vaccine, they will then get them the information on how to be vaccinated.
Okay, thank you.
Any other questions? Okay, thank you all for joining us. Once again, apologies for some of the audio issues. Really unfortunate how that happened, but they happened. We recorded this press briefing. If you need it, please reach out to me and I will send you the full file. Otherwise, I'll be available for any further questions. And have a great day. And thank you to all of our speakers.
Thank you, everyone.